My background is also family medicine and emergency medicine, and I practice, I guess it's 15 years now in the Emerge. I still work at St. Paul's. And I think two things really brought me to integrative medicine. One is the fact that I started to realize that many things that came to see me in the Emerge, by the time I saw them, it was too late. It was the end stage of many diseases. And yes, we could do some heroic things and save them from massive heart attack or their strokes, but often it was too late. And you realize that many of these things could have been prevented way, way before. And if we changed the trajectory of that person's life before, 10, 15 years before, they would not be in that situation. So that was the one thing. The second thing which I learned from the emergency room was what really works well in acute care medicine, where Western medicine excels. And I also saw where it failed. I saw a lot of chronic diseases, many things that we had no idea what to do. And the third piece for me was my journey into yoga. And yoga was definitely the gateway for me into a much more expanded view of what health and wellness was. The Institute of Medicine, which is a think tank in the US, came up with what they call the 4 Ps of the new medicine. So predictive meaning the new science of genomics is going to help us better predict the probability of disease for you, for individuals. Preventive in the sense that based on the genomics, we'll be able to tailor specific things. You'll know more about your risk profile, and therefore you'll be more motivated to make changes. Personalized, we're going to have, again, the science that's going to help us target much more specific interventions and treatments that are specific for you, not just a broad population. And the new medicine will be participatory. It will be empowering. It will encourage active engagement, personal decisions about wellness. And the new medicine will also have a strong emphasis on wellness, chronic disease management, and prevention. That's where we need to go. It's going to de-emphasize the use of costly invasive technologies, at least as the first line. Always use it where it makes sense, but let's not use it as the first line. The new medicine will have a strong emphasis on lifestyle and environmental factors which interact with our genes. The new medicine will realize that the quality of the patient-provider interaction is absolutely paramount. It's the foundation of health and healing. The new medicine will recognize that the natural ability of the body and mind to heal is acknowledged and supported. We have to realize that one disease may have multiple causes, and one initiating factor may actually cause multiple diseases. So this is the new paradigm that the medicine needs to go to. It really has to reflect what we really understand as the system views of life, where the whole is greater than some of its parts. Now, interesting, the more ancient medicines like Chinese medicine, Ayurveda, they always looked at it as a big system. They never actually broke it down in a reductionist way into different silos. They always looked at patterns, the whole system. Health is a dynamic equilibrium. It's not a static sort of function. And Andrew Weil has this quote, health is wholeness, wholeness in the most profound sense. Okay, there's a lot of terms and definitions, and there's a lot of confusion about these terms, so I'm going to just go over some of it. So the term CAM, as defined by the National Centers for Complementary and Alternative Medicine, is a group of diverse medical health care systems not presently considered to be part of conventional medicine. To me, that just means it's a grab-all sort of category where we put everything else which is not termed conventional. And these sort of terms, I think, still kind of are very allopathic centered, meaning it's either alternative or it's a complement to the main system, but it's definitely not seen on equal playing field. So the way we really want to view it is much more what we call integrative. No one has a monopoly on truth. We want to integrate all these different systems in an intelligent fashion. So integrative medicine, we define this as a healing-oriented medicine that takes account of the whole person, body, mind, and spirit, and I would also say community as well. It emphasizes the therapeutic relationship and makes use of all appropriate therapies, both conventional and alternative. This Wheel of Health by the Duke Integrative Medicine Center puts you in the center in this mindful awareness. And around it is a circle of self-care with the different domains of mind-body, movement, exercise, nutrition, personal development, physical environment, relationships and communication, and spirituality. Those represent the central aspects of health. And around it is a strong emphasis on prevention and the combination of conventional and complementary approaches. Now, integrative medicine it's very different from the term CAM, and in a sense, it's got a much greater mission. The mission is really to restore the focus of medicine on health and healing, and not just on disease and symptom management. And the root of medicine is to restore back to order using measured action. That's what medicine means. It means it's part of the term, the Latin root is measure, to kind of measured action to bring back into balance. So I think a lot of integrative medicine is going back to the roots of medicine, which is looking at health and healing. Functional medicine is a type of integrative approach, but it really strives to uncover the root causes of illness by looking at the entire mind, body, spirit, and looking at the interaction of genes in the environment. It's a systems biology approach, and it looks at patterns of dysfunction. It's interested in treating the whole person, not isolated symptoms or diseases. Strong emphasis on food as medicine, as the science of nutrigenomics, and Ashley's going to talk about that. And again, recognizes that health is really a continuum, and we need to intervene and find ways to restore back to balance when it's in the latent phase before it reaches physical manifestations of overt disease. So Mark Hyman, he's a doctor and the chair of the Institute of Functional Medicine. Disease goes away as a side effect of getting healthy. Kind of like that. This is a really great pictorial that kind of gives you a sense of how we're approaching things differently. Western medicine in conventional sense focus on what we call an organ system diagnosis. So we're looking in your lungs, in your kidney, in your heart. We look for positive blood tests, we look for positive findings on x-rays, we look for tissue that we can actually see as disease. And then we break them down, as Devin was saying, into all these different ologies. So it's a reductionist, solid approach, gastroenterology, neurology, cardiology, all that stuff. Functional medicine appreciates all that organ system diagnosis, but we're looking at the roots. We're looking at the roots of what causes those end manifestations. A lot of diseases are the end manifestations of clinical imbalances that have occurred for many, many years. And that's what we're trying to detect in functional medicine, disease. Also, we dig deeper into the roots and we really go to the mind and spirit. We look at the genetic predisposition. We look at how experiences, attitudes, and beliefs have a strong effect on the core part of the person. And then we look very, very strongly on the environmental inputs that affect the person. So psychosocial, physical exercise, trauma, diets, nutrition, air, water that we breathe and drink, the effect of xenobiotics, pollutants, microorganisms, radiation. So functional medicine really looks at the whole picture, but focuses a lot more on the root causes. Whereas conventional medicine, we're a little bit too much focused on the organ system diagnosis, which is still very useful, but often fails to pick up things which have not yet manifested in overt disease. Like I see in Emerge, a lot of times people come with all these different signs and symptoms. You do the blood tests and the CAT scans and all that stuff, and you can't find anything. There's something wrong with the person, but you can't detect it. Our tests are not sensitive enough. Our approach is not sensitive enough to detect the imbalances. Basically say, well, we can't find anything wrong with you, go home. And it's very frustrating for the patient because they know there's something wrong. So functional medicine, I think, is a very, very powerful tool to look at these imbalances. Okay, another tool which we find useful in functional medicine is something called the timeline. The most important thing here is really deeply understanding the patient's story. And you cannot deeply understand the patient's story in a 10-minute visit or 7.5-minute visit. So we try to build an entire timeline, an entire narrative of the person's life from the time of birth, even prenatal conditions, to identify the antecedents of what may cause disease many, many years later. Then we temporally map signs and symptoms and illnesses and diseases along a timeline and try to temporally map that to triggers. What happened at that time when you started having abdominal pain at age 13? What happened in your life? What happened emotionally? What happened physically? Link those. Very, very powerful. And the last thing we looked at are mediators. So given the fact that the organism wants to restore balance and we have a huge innate capacity to restore balance, why is the disease progressing? Why is there still illness? What are the perpetuators of this unbalanced state? I love this classic quote by Sir William Osler. I think it's so, so very important. It is more important to know what person has the disease and which disease the person has. And I think the more we learn about this, it's so, so true. So another little map here, this is what we call the functional medicine matrix, and gives you a sense of how we're approaching things differently. Again, we're looking at antecedents, identifying predisposing factors, triggering events or activators, mediators, perpetuators. Then in this framework, it's more of this matrix model. In the center is the mental, emotional, spiritual self, which is always at the center. Around it are the functional systems of life and optimal functioning. So assimilation function, which is digestion and absorption of nutrients. Defense and repair, that's looking at immune system function, inflammation. Energy regulation, energy management systems. Biotransformation, elimination, that's liver detoxifications, elimination systems. Our transport systems, cardiovascular, lymphatic systems. Communication systems, so that's our endocrine system, neurotransmitter function systems. And structural integrity, from cell membrane integrity to bone and skin and all the other structural elements of the body. So you see here, we don't break it into heart, kidney, lung, brain. We look at the functions of the system, and they're all interrelated. So we find this a very, very useful tool upon which to overlay the patient's story retold. Again, very strong emphasis on all the personalized lifestyle factors. So we want to recognize sleep and relaxation, exercise and movement, nutrition and hydration, stress and resilience, and relationships and networks. Those are the key levers of optimal health that we have strong, strong emphasis on. So our belief is the integrative and functional medicine approach is a very powerful tool to look at complex chronic diseases because we're looking at imbalances in the systems. We're looking for patterns of dysfunction. And often with these complex diseases, a single siloed approach based on organ diagnosis fails to appreciate the interrelationships that happen. Autoimmune disorders, inflammatory conditions of any kind, I think are very amenable to this type of approach.
Should we do a step?